Hey everyone, welcome to my channel. For all my returning viewers and subscribers, thank you for sending me so much love. And to all those of you who are new to this channel, let me take a moment to quickly introduce myself. I'm Dr. Upasana Gosalia, founder and head dental surgeon at iSmile Dental Clinic located in Mumbai. My channel is dedicated to addressing a lot of common health issues and oral health issues that a lot of us have. So please do remember to subscribe, hit the bell icon to get regular updates and notifications because I really want each one of us to be the best healthy version of ourselves. Today we are going to be talking about bad breath, or as we term it as halitosis. Now this is such a common and widespread issue. Almost 50% of adults suffer from bad breath at least once in their life. This is how prevalent it is. So it's very important that each one of us know about it, talk about it, and we take a step to addressing it and getting back to healthy, fresh breath. Halitosis is a multifaceted issue, and this requires a holistic approach towards treatment, right from having a diligent oral care regime to regular checkups with your oral care professionals, and also understanding what the systemic causes and root causes could be like. But before we delve and dive deeper into this subject, let us just quickly start by understanding why this bad breath arises in the first place. How does it come and how does it develop? So, typically, bad breath can be of two types. I would say it could be arising from a local source or something which is present locally in your mouth, or it could also be arising from a systemic source, which means something somewhere in your body is not right, it's wrong, and that is manifesting itself in your mouth, in the oral cavity, in the form of bad breath. So, let's start with the local factors or the local problems. First one being poor oral hygiene maintenance and lack of a good oral care routine. So, somewhere you're missing out on something, be it you're brushing, flossing, or sometimes if you've skipped using the electric toothbrushes as prescribed to you by your dentist, and you have a lot of plaque and tartar buildup in your mouth. Plaque is nothing but a soft, sticky layer of dirt which forms on the surfaces of your teeth, which over time, if not cleaned thoroughly by yourself, of course, and if you've not been visiting your dentist regularly for your cleanups, this plaque can calcify and further form into a very hard substance which is called as tartar. This is really a bad thing, nasty thing to have in your mouth because it harbors a lot and lot of bacteria and germs, and these further are the reason for your bad breath. Now, your mouth in general as well hosts millions of bacteria. These are a combination of both good as well as the bad bacteria. But when the bad bacteria are overpowering the good ones, that's when your bad breath and oral problems start to arise. So, bacteria use the food remnants which are stuck behind on the surfaces of our teeth and mouth due to improper cleaning. So, the bacteria attack these food substances, and as a byproduct of their metabolism, they release some foul smelling gases like hydrogen sulfide, which in turn give rise to your bad breath. So, the root cause of all of this is that dirt, plaque, and tartar, which needs to be thoroughly cleaned and rinsed out. Another common factor for bad breath locally present in the mouth can be ill fitting dentures, or maybe presence of large cavities which need to be addressed. You've not filled them. There are big holes which are drawing all the food, dirt, and remnants, which is further giving rise to a lot of bacterial action. Thirdly, you could be consuming some odor rich substances like onion and garlic, and the smell of which lingers on in your mouth, further adding to the bad breath problems. Smoking again is a very important local factor which gives rise to bad breath because smoking leads to xerostomia or dry mouth. And because of dry mouth, your saliva content naturally is lesser, and this gives a chance for bacteria to breed and increase in numbers, giving rise to your bad breath. And lastly, having a very high sugar diet or a diet which is rich in refined carbohydrates. Bacteria and germs love to attack on refined carbohydrates. So the more you consume, the more bacteria are going to grow and attack on them. And that's how all the bad breath will start coming in. You must understand and limit your intake of all these refined sugar rich foods. Next, coming to the systemic sources or the reasons what could be wrong in your body giving rise to this bad breath. Firstly, uncontrolled diabetes, long-standing diabetes can both give rise to a foul bad smell in the mouth. Secondly, you could be suffering from some kidney or liver diseases, which are also in turn giving rise to your bad breath. In addition, upper respiratory tract infections, tonsillitis can all be the sources of bad breath for you. Talking about the gastrointestinal system, if you're suffering from gastrointestinal reflux disease, severe acidity, you have indigestion, or even individuals who go on fasting for prolonged periods of time, all of this can lead to bad breath issues. So now that we've understood what the reasons for this bad breath can be, let us now dive deeper and delve into what you can do in order to treat yourself and get rid of this bad breath for good. First and foremost, obviously, is starting with maintaining excellent oral care. This starts with, of course, twice in a day brushing for at least 2 minutes every time. You need to address individual areas of your mouth. Do not miss out on any area. A lot of times people are in a hurry. They just scrub the outer surfaces, conveniently missing out on the inner ones. They also need to be scrubbed because that's where all the plaque and tartar buildup actually is. So you need to understand the right technique of brushing. If you're someone who just cannot get the right brushing technique and you end up with a lot of plaque and tartar buildup, then maybe switching on to electric toothbrushes could be a great idea for you. You can discuss this with your oral healthcare provider as to which one would be the right for you, and also how to use it and where and how to effectively clean out all that dirt. A very, very important step in maintaining good oral hygiene is scraping your tongue. This step is conveniently forgotten by a lot of us, but your tongue, especially the backside of your tongue, which is near your throat, this place harbors a lot of germs and dirt. And if you're somebody who has reflux and there's a lot of acidity and all those food remnants coming up, then again this is like a breeding ground for bacteria to grow. So do remember to scrape out your tongue every time. That means twice in a day, morning and night, after your brushing. This will ensure that you stay away from bad breath. Now, secondly, in addition to having a good home care routine for oral hygiene, it is vital that you also visit your dentist to get your routine cleanings done, which I prescribe at least twice in a year, which is every 6 months. Now, see, there are some deep pockets and areas in the mouth where no matter how hard we try to brush and reach, some surfaces just cannot be scraped. And those are the areas where all the tartar has been built up and calcified. The foul smell and the bad breath could easily be originating from some of those. If this situation is left untreated in future, in the long run, you can also start having problems that are called as gingivitis or periodontitis. Both are forms of gum disease. So it's best to stay away from them. Go for your regular follow-ups and cleaning sessions. Thirdly, stay hydrated, have lots and lots of water. If you're not hydrated enough, your saliva production goes down. And when the saliva production goes down, you have dry mouth. Like I said earlier in the video, bacteria just feast onto the food remnants, and that's what produces the bad breath in the first place. And saliva is a great source to wash out all that food debris. Some areas in our mouth are just self-cleansing, which saliva can take care of. So staying hydrated is both great for your body as well as great for your mouth. Next, I also advise a lot of my patients to do this age-old Ayurvedic practice, which is called as oil pulling. It literally draws out all the dirt and the nasty bacteria from the mouth, making sure that you never have to suffer from bad breath. So if you want to know more about this beautiful technique, how it's done, what is to be used, what's the right time and all of that, then please do check out my video. I will be linking it in the description box. Next, you can also use a medicated mouthwash. Now, there are a lot of mouthwashes that are available over the counter. You don't really need to go to your dentist for a prescription. The ingredient that you guys need to look out for is chlorhexidine. Any chlorhexidine based mouthwash is great because it takes care of plaque. But one thing to bear in mind here is do not use a mouthwash which has alcohol. Please look out for the alcohol-free label, because the use of alcohol-based mouthwashes in the long term has been linked to a lot of taste bud issues and also burning sensation in the tongue, etc. So it's best to stay away from these. Select and choose alcohol-free ones. Another small tip that I love to give to all my viewers and patients is never to mix a mouthwash with your brushing. There has to be at least a minimum of, say, an hour's gap between the two, because both your mouthwash as well as the toothpaste are rich in fluoride, and rinsing your mouth with a mouthwash immediately after using a fluoridated toothpaste will kind of give away and rinse out all the fluoride that the toothpaste has given you, which can in turn lead you or make you more prone to cavities. We do not want that. So please refrain yourself from doing it immediately after brushing. The right and the best time I would say to do and use a mouthwash would be after your major meals, which is your lunch and dinner. So you can either choose to use it directly if you're okay to take that taste, or you can alternately just dilute it, say in half a cup of water, and rinse using that water as well. A lot of my patients have come back to me and said that I do not want to use chemical based products like mouthwashes, and I would like to use something which is natural. So I have a few tips for this, and this will certainly help you out. If you want to make your own mouthwash, a DIY mouthwash, then all you have to do is take a glass of lukewarm water and add a spoonful of soda, the same soda that you use in your kitchen for cooking. Just add a teaspoon of it into that water. Make sure that the water is lukewarm and then rinse using that water. This again is great antibacterial. It helps to keep your bad breath away and also prevents cavities. And secondly, if you want to up your game in DIY mouthwashes, what I also recommend to do is just add a drop of essential oil. Essential oils are great. They have anti-inflammatory properties and also antibacterial properties. So what you can use is either peppermint oil, tea tree oil, or clove oil. And by adding this will not just increase and make the DIY mouthwash more potent, but will also add a very refreshing taste to that mouthwash. And this will make sure you have a beautiful, fresh breath. Another very simple thing that you can adapt is either chewing on mint leaves or on a piece of clove. This is all natural with no side effects. So why not give that a try as well? Lastly, you can also try chewing some sugar-free gums. This will help to keep your mouth active, keep the saliva flow in place, and keep you away from bad breath. So that's all I wanted to talk to you today in this video about bad breath. I'm sure there's at least one of these things that you can try to get fresher and cleaner breath. If there's anything else that you guys are doing for your bad breath problems, then do let me know in the comments below. And also, if you've tried any of the techniques that I have shared, especially if you've tried oil pulling in the past, or if I've inspired you to start it and do it from today, then please let me know in the comments how it went for you. Has it helped you or not? I love to hear from you guys. And like I say always, until next time, stay healthy and keep smiling.